The beam from Mark's dive light cut through murky water, illuminating four panicked faces huddled in the cave's air pocket. The pressure gauge on the last oxygen tank was edging dangerously into the red zone. 40 minutes, at most. Devil's Eye, a renowned underwater cave system in Florida's Ginnie Springs, had lived up to its ominous name today. What started as a routine guided cave diving tour had turned catastrophic when an underwater tremor dislodged rocks near one of the narrower passages, partially blocking the exit route. 4 tourists, 2 men and 2 women, were now trapped in a small air chamber 70 feet below the surface. Initial rescue attempts by the tour guide had failed. He'd barely escaped himself to call for help. The situation turned dire when rescue coordinators learned that professional cave rescue divers were at least 2 hours away. Then someone mentioned Mark Walsh was vacationing nearby. At 42, Mark was 3 years into civilian life after spending 15 years as a Navy Special Operations combat medic diver. He had been relaxing at his cabin when a park ranger knocked on his door. "I heard you're the underwater doctor," the ranger said breathlessly. "We got civilians trapped in Devil's Eye. One's badly injured." 20 minutes later, Mark stood at the cave entrance, assessing the situation with the calm precision that had kept him alive through 3 combat deployments. The trapped male tourist has his leg pinned by a rock. The tour guide explained, voice shaking. "He's bleeding badly. We can't move him through the restriction." Mark nodded, already mentally cataloging equipment as he prepared to dive. "Show me exactly where they are." Mark glided through the water with practiced efficiency, navigating the twisting passages that had become this vacation group's prison. His military-grade dive light swept methodically across the submerged limestone formations, revealing the path the guide had hastily mapped out. When he finally surfaced in the air pocket, 4 pale faces turned toward him. The trapped divers had removed their tanks to conserve air in the small breathing space. "Navy rescue diver," Mark announced calmly. "Let's assess the situation." The injured tourist, Brian Harwood, 34, lay partially submerged on a rocky shelf. His right leg disappeared beneath a boulder the size of a small refrigerator. The water around his leg shimmered with a crimson cloud. Mark performed a rapid trauma assessment, his trained hands moving with practiced precision. "Arterial laceration, posterior tibial artery," he muttered. The man's diving suit had been torn open, revealing a deep gash where the falling rock had sliced his calf before pinning the leg. "Can you move the rock?" Brian asked through clenched teeth. Mark studied the boulder's position. "Moving it without proper equipment risks causing a secondary rockfall or further injury," he explained. "And based on your blood loss, you don't have time to wait for cave rescue specialists." The environmental challenges mounted quickly in Mark's mental assessment. The narrow exit passage meant a standard rescue stretcher couldn't pass through. The water temperature was 68 degrees, warm for a cave, but cold enough to accelerate hypothermia in an injured diver. Most critically, their combined air supply, even carefully rationed, would last barely 40 minutes. As Mark inventoried the available resources, his mind flashed back to his specialized Navy training. During one particularly grueling exercise in the Philippines, his team had practiced emergency underwater medical procedures in flooded cave systems very similar to this one. "We need to stabilize that artery before attempting any extraction," Mark announced. "Otherwise, moving him means he bleeds out." Mark returned to his mental checklist. 2 small emergency oxygen tanks, a basic first aid kit from one of the tourists, his own comprehensive dive medical kit, and a collection of dive tools. Not ideal, but workable. The other tourists watched anxiously as Mark unstrapped his equipment and began laying out specific items on a dry rock ledge. "The nearest chamber with enough space to work is back to the restriction," the guide explained, pointing to the partially blocked passage. "That's not an option," Mark replied, his voice steady. "His femoral pulse is already weak. He's lost too much blood. We don't have time to move him before dressing that artery." One of the female tourists, a nurse as Mark had just learned, looked confused. "You can't possibly mean..." Mark met her gaze directly. "Yes, I'm going to have to repair that artery right here, underwater." He began unwrapping his specialized dive medical kit. "And I'll need your help." As Mark prepared his equipment, His mind flashed back to the Naval Special Warfare Medical Training Center in San Diego. Environments of opportunity. His instructor had called it. You'll provide critical care wherever the mission finds you. Underwater, in flight, under fire. Those training scenarios that seemed almost sadistically impossible at the time. Performing a pneumothorax needle decompression inside a flooded helicopter simulator. Suturing lacerations while being randomly dunked underwater. Placing tourniquets with numb, cold-shocked hands. Now, those torturous drills were about to save Brian's life. I need to construct a transparent working space around a wound, Mark explained, switching seamlessly to instructor mode. In the Navy, we develop protocols for underwater wound treatment when evacuation isn't possible. He turned to the female tourist, who'd identified herself as Elena, an ER nurse. I need you to hold this underwater pen light exactly where I direct it, he said, handing her a specialized dive light with a narrow, focused beam. From his kit, Mark retrieved a transparent plastic sheet and what looked like dental putty. Military-grade underwater surgical field, he explained, noting their confused expressions. The polymer sheet creates a small, workable dry space underwater, and this epoxy compound seals it temporarily to the skin. Mark addressed the remaining tourists and guide. Monitor the oxygen levels continuously. When we hit 15% remaining, alert me immediately regardless of where I am in the procedure. Working with methodical precision, Mark positioned himself in the water next to Brian's pinned leg. I'm going to apply a combat tourniquet above the injury site first, he explained. Then I'll create the surgical field and work on the artery. The specialized tourniquet from his kit looked different from standard models, designed with underwater deployment in mind. Mark secured it with practice movements, the muscle memory from hundreds of training applications evident in his efficiency. Next came the transparent barrier. Using the putty-like substance, he created a seal around the wound area. The other divers watched in amazement as he pressed the flexible plastic sheet into place, creating a small dome of air around the injury site while remaining underwater. Navy Dive Medicine Innovation, Mark explained, developed for special operations where injured divers couldn't surface immediately. Inside the small underwater workspace, Mark could now access the bleeding artery without the water constantly washing away his visual field and diluting any applied medications. Working through the plastic barrier was challenging. His fingers felt stiff and movements were restricted, but the alternative was certain death for Brian. Hand me the arterial clamp, Mark directed Elena, pointing to his specialized kit, and the hemostatic gauze, the white package with the blue stripe. As Elena assisted, Mark explained each step, both to keep Brian informed and calm and to ensure Elena could follow his instructions precisely. The hemostatic compound accelerates clotting, military grade, works even in hypothermic conditions and with blood thinners present. Mark's hands moved with practiced precision as he cleaned the wound site and located the damaged artery. Underwater, blood dispersed differently, flowing in slow-motion clouds rather than the pulsing spurts he was accustomed to on land. This required a modified technique to visualize the vessel. I'm using a temporary vascular shunt, Mark explained, retrieving a small tube from his kit. It's a battlefield technique to restore blood flow while creating time for proper vascular repair. In the Navy, we use these during underwater extraction operations when complete repair wasn't immediately possible. The technique had been developed for special operations combat diver missions where injured team members needed to remain underwater for extended periods during covert operations. Never had Mark imagined using these skills on a civilian tours in Florida, but the principles remained the same. The shunt is in, Mark announced after several tense minutes of delicate work. Now I need to secure it and close the surrounding tissue to prevent further bleeding. As Mark worked, his military training manifested in his absolutely steady hands and rhythmic breathing. Techniques specifically developed for precision work under extreme pressure, both literal and figurative. Oxygen at 25%, announced one of the tourists, his voice tight with anxiety. Mark acknowledged with a nod, but didn't rush his movements. Haste now would undo everything. Through the clear surgical field he created, he could see the temporary shunt was holding, diverting blood past the damaged section of Brian's artery. I need to place 3 stabilizing sutures to secure the shunt, Mark explained, reaching for his specialized underwater suture kit. Unlike standard surgical needles, these were slightly magnetized to prevent them from floating away if dropped, another innovation from Naval Special Warfare Medical Research. Suddenly, the boulder shifted slightly. Brian screamed in pain as fresh blood clouded the water. Secondary hemorrhage. Mark stated clinically, though his pulse quickened, the rock movement toward the distal end of the vessel. This complication meant Mark now needed to work on both ends of the damaged artery. The surgical field was filling with blood faster than the small suction device could clear it. Oxygen at 20% and dropping faster now. Came the update. Mark made an instant battlefield calculation. Everyone but Elena take minimum breaths. Conserve air. He turned to Brian. Your body's going into shock. I need to work faster, which means more bleeding temporarily. Stay with me. The injured man's eyes were becoming unfocused. A danger sign. Mark retrieved a pre-filled syringe from his kit and injected it through the surgical field into Brian's thigh. Combat anti-shock compound, he explained to Elena, developed for Special Forces medics. Temporary measure. Mark's world narrowed to the small transparent dome where his hands worked with machine-like precision. He placed clamps on both ends of the damaged vessel and began the delicate work of securing the shunt more permanently. Oxygen at 15%, came the warning. Mark's own dive computer showed his personal air supply was running even lower after his initial scouting of the cave system. He'd need to surface soon or risk hypoxia himself. The final suture was the most difficult. The angle required Mark to contort his wrist in an awkward position, fighting both water resistance and confined space. A memory flashed through his mind, his instructor forcing him to suture underwater while wearing thick welding gloves, preparing them for exactly this type of impaired dexterity. Can't feel my leg anymore, Brian murmured, his words slurring. That's actually good right now, Mark replied calmly. Less pain while I finish. Oxygen at 10%. We need to move now. The panic in the tourist's voice was unmistakable. Mark took a critical decision. He removed his own emergency regulator and passed it to Brian. For breaths only, he instructed firmly. I need you conscious for the next part. Working now against his own building oxygen debt, Mark completed the final securing suture and applied a specialized pressure dressing designed for underwater application. Done, he announced, his vision beginning to narrow from oxygen deprivation. He quickly removed the transparent surgical field and secured the waterproof bandage. Mark turned to the other divers. We need to stabilize the leg for transport. Use my underwater splint kit. We'll need to shift the rock just enough to free him without causing further injury. Using the remaining oxygen, they worked together to carefully position leverage tools from Mark's kit. With coordinated effort, they managed to shift the boulder just enough to extract Brian's damaged leg. As they prepared for the difficult extraction through the narrow passage, Mark's training kicked in once more. He performed one final check of the repair and bandaging, knowing the journey out would stress the injured limb. Oxygen critical. 2 minutes maximum, shouted one of the tourists. Mark looked at Brian's now stabilized leg, the bandage holding firm despite the water. It would have to be enough. With a hand signal learned from countless military extraction operations, he indicated it was time to move. Sunlight had never looked so beautiful as when they finally emerged from Devil's Eye Cave. Professional rescue teams had arrived during the underwater surgery and were waiting at the surface with medical equipment and emergency transport. Paramedics rushed to receive Brian as the divers brought him to the shore. One of the emergency physicians quickly assessed the underwater medical work as Brian was loaded into the ambulance. Who did this vascular repair? He asked in disbelief, examining the professionally stabilized leg. He did. Elena pointed at Mark, who was quietly packing away his specialized equipment, avoiding the growing attention. 3 days later, Mark reluctantly attended a small ceremony at Gainesville Regional Hospital. Brian was recovering remarkably well, his leg saved from what surgeons had confirmed would have been certain amputation without Mark's underwater intervention. The vascular surgeon said he couldn't have done better in a fully equipped operating room. Brian's wife told gathered reporters, tears streaming down her face. Mark performed a miracle underwater with military equipment and a flashlight, When pressed for comment, Mark shrugged uncomfortably. It wasn't me, it was the training. The Navy prepares you to serve no matter where or when you're needed. This rescue reveals something profound about our military personnel. Their training doesn't just prepare them for combat. It transforms them into resourceful problem solvers ready to help in any crisis. Every day, veterans walk among us carrying these extraordinary skills, often unrecognized until the moment crisis strikes. Dr. Renfield, the vascular surgeon who performed the definitive repair, put it best. What we witness here isn't just about medical skill. It's about the unwavering commitment to save lives that military training instills. That commitment doesn't end when a uniform comes off. As a young, aspiring Navy recruit approached Mark after the ceremony, asking about military medical training, Mark smiled genuinely. The training pushes you beyond what you think is possible. But on days like these, it's all worth it. What extraordinary military skills have you seen applied in civilian emergencies? Have you ever been helped by a veteran using their training in an unexpected way? Share your stories in the comments below. And if this underwater rescue inspired you, help us honor military medical professionals by liking and subscribing. Every share helps recognize these everyday heroes walking among us.